All right, today we are going to play medical detective. We've got two women, two really different sets of symptoms, and basically two medical mysteries to solve. We're going to see how doctors use these subtle clues to connect the dots and find the right diagnosis. Let's get right into it.
So our story kicks off with two women at completely different stages of their lives. You've got one who's in for a routine checkup, and the other is a brand new mother. Their cases couldn't be more distinct, and that's actually what makes them so perfect for helping us understand breast health.
Okay, first up, we have a scenario that really millions of women go through every year, a routine screening. It might seem pretty ordinary, right? But as we're about to see, this is exactly where the power of early detection really shines.
So here's the rundown. A 50-year-old woman goes for her standard mammogram, and it flags something suspicious. A biopsy confirms it: invasive lobular carcinoma. Now, that's a type of breast cancer that starts in the milk-producing glands. But here is the most crucial part. The staging shows it's localized. It hasn't spread. That one little fact, it changes absolutely everything.
And this brings us right to the big question for our first case. You've got a confirmed, early-stage, localized cancer. What's the best move? What's the right course of action? Let's walk through the options, just like a clinical team would.
So now we're at a crossroads, and the goal here isn't just to treat the cancer, it's to choose the right tool for this specific job. It's all about precision, and that means we have to carefully weigh the pros and cons of each potential path.
This slide really lays out the two main surgical options nice and clearly. Over on the left, you've got breast-conserving surgery, where they just take out the tumor and a little bit of healthy tissue around it. Then on the right, you have a total mastectomy. Now, for our patient whose cancer is small and localized, that less invasive option on the left is a very strong candidate. A mastectomy is generally for more advanced or widespread cancers.
But wait, before we land on an answer, it's just as important to know what not to do. Using chemotherapy by itself? Not the standard approach for localized cancer like this. Observation or just watchful waiting? Absolutely out of the question for an invasive cancer. And immunotherapy, while it's a powerful tool, it's reserved for very specific advanced cases. So the answer is a 1-2 punch. First, a wide local excision. That's the breast-conserving surgery we talked about, to physically get the tumor out. But surgery can't always get every single last cell. And that's where the second part comes in, radiation therapy, which cleans up any microscopic cancer cells that might be left behind. This combination is the standard of care because it has been proven time and again to be just as effective as a full mastectomy for these early-stage cases.
And this really hammers home the key takeaway from our first case. Catching cancer early opens up treatment paths that are way less invasive but are just as effective. Okay, so now we're going to shift from a pretty clear-cut screening case to something much more ambiguous, where the patient's life circumstances are the biggest clue.
We're shifting gears completely now. Our second patient is much younger, and her symptoms have shown up just after she's had a baby, a time when the body is going through massive changes, which you can imagine can make a diagnosis really tricky.
Okay, here are the details. She's 28, a new mom, and she's breastfeeding. She comes in with all the classic signs of inflammation in one breast. We're talking pain, swelling, warmth, and tenderness. This paints a very, very specific clinical picture.
So, the team orders an ultrasound to get a better look. And this is it. This is where we find our single most important clue. Even with all that swelling and inflammation, the ultrasound shows no collection of fluid. This finding is absolutely essential for narrowing down what's going on.
So, putting it all together, her postpartum status, those specific symptoms, and that key ultrasound result, what's the most probable diagnosis? Let's work through the possibilities.
This is where that clinical detective work really shines. We're going to use the evidence to eliminate the wrong answers one by one until only the truth is left standing. This table lays it all out for us. Let's go down the list. First, a breast abscess. Well, that would mean a fluid collection, but our ultrasound showed nothing, so that's out. Next up, a galactocele, which is a milk-filled cyst. The key there is that they're usually not tender, and our patient is definitely in pain, so we can cross that one off too. And the others, fat necrosis and fibrocystic changes, they just don't fit her history or her symptoms. None of them tick all the boxes.
After we've eliminated all the other possibilities, we arrive at the correct diagnosis: lactational mastitis. It's an inflammation of the breast tissue that's actually very common in breastfeeding mothers. It perfectly matches her symptoms of localized inflammation and, critically, that ultrasound finding of no abscess.
And a lesson here is crystal clear. The patient's context, the fact that she was 10 days postpartum and breastfeeding, was a most important clue of all. It literally guided the entire diagnostic process from start to finish.
So, we've walked through two completely different clinical stories, one about cancer, one about inflammation. But what do they teach us when we put them side by side? Let's boil it all down to a few core principles.
3 key ideas really pop out. First, early detection is absolutely critical, just like we saw in case 1. It's what makes effective, less invasive treatments possible. Second, treatment is not one size fits all. It has to be super specific to the diagnosis. And third, as case 2 showed us so powerfully, patient context is everything. A person's age, life stage, and history, they're all vital clues.
And that brings us to our final thought. These cases aren't just about memorizing medical facts. They're about the power of putting the pieces of a puzzle together. So I'll just leave you with this question. How does understanding the why behind a diagnosis empower each of us to be a better, more active participant in our own health? Something to think about. Thanks for digging into this with me.